Yeah. I'm one
You're
of
another
them.
one, so yeah.
I'm one of the young ones.
We have
Like, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
So, action on the agenda are minutes. Approval of- Both minutes? Okay, December 20, 30th and 29th. I have a second. Second by Phil. Any comments or concerns?
Aye.
Order of business is okay, the transfer in front of our regular use, so the commission is to advance the transfer.
Mr. Chairman, essentially, what's happening here is we have an inflationary situation that's spiraling out of control. In Shelley's department, she has one set of inflation numbers, which are 7% across the board for everything. The problem with food and the cost of goods consumed at the nursing home is there's just an additional food cost inflation of 7%. So the cost of most of her food products that are being consumed on site have gone up approximately 20%. The other primary cause of the budget transfer is the adjustment in wages. While the wages have been increased and they were approved last year by some of the ARP funds by delegation. The fact is, although they're higher, they're still not high enough for her to secure the people she needs. For example, she lost one receptionist who she has to have at the front door. She hired another one with great expectations, offering her $70 an hour. She got a phone call yesterday, showing, really sorry, I'd love to work for you, but
Today.
oh, today.
I thought we were doing the transfer.
No, I'm just talking about the wages overall on the budget transfer.
Okay.
And she found out today, I thought yesterday, that the woman declined the offer after all to go work in the Maryland Public Library for $20 an hour. So this is what we think that. Deborah?
Yeah, that's correct. The Glendale experienced the same wage increases and problems with their staff that we had. So they gave their staff an increase, a wage increase. Also, obviously, the food cost is up, and we didn't expect that they were going to spend as much as they did. So while they did not exceed their contracted price, they did exceed our budgeted amount. So that's why we're asking for a transfer from nursing full-time wages to contracted dining services in the amount of $29,017. It's worth noting that nursing home still has a significant surplus in total.
Question? I'll open up the question. So,
Thank you, Mr. Chair. I noticed in the food service management agreement between Glendale Senior Dining and Belknap County that it's basically a cost plus arrangement. And they indicated in their addendum number 1, the first year's cost pro forma, and then they had a cap. And have we received a new invoice that justifies this increase in cost?
No, because at the beginning of the year, they give us what their total cost will be, their pro forma for the year, January 1st, 2021. And even with this cost increase, they did not exceed that contract. So in total, the county paid $1,292,000 to them. The contracted amount on their pro forma was $1,398,000. So we didn't even meet the amount that they thought we would, but we didn't budget enough to cover their full contract. That's the problem.
What was the budget amount?
The contract amount was $1,398,586.
Yeah, but what did we actually put in the operating budget?
Oh, for the nursing home, yes, it was $1,100,000.
So when did we find out that this was going to be over budget? Because our last, what I printed in front of me from December 15th showed a surplus of $21,500.
Really when the bill came, which was a couple of weeks ago, the day of this, I think, right around first of the year, and we got the bill. And we knew it was gonna be close, and we didn't expect it to be the highest bill of the year. We were hoping it'd be the lowest bill of the year. So when we got the bill, we knew we were gonna go over that amount.
Any other questions?
Yes, sir.
Dennis?
Thank you.
So,
Has the increased amount been paid
Yes,
before the transfer?
that's
I'll make the motion to approve this transfer. It's unfortunate that we're in this state of escalated food pricing. Everything is just gone wacko since we printed and given away the country's treasure. So, this is just the beginning of having to pay for it, I guess. Second by. All those in favor?
Discuss.
Okay, further discussion.
Thank you. I have a long record of food transfers after the end of the year. And in fact, we've had many discussions about transfer requests we need to come before the problem arises. And here we are again.
Thank you, Mr. Chairman. We had several meetings of this executive committee during the month of December, and I'm assuming that this excessive payment arose or was known about by then prior to its disbursement. So I don't understand why it was not brought to the executive committee as a transfer request back then.
Well, we just heard that the bill just came in a couple of weeks ago, and
But they said they already paid it.
I believe we heard that the bill was dated January 14th for services for December. So all of the meetings that we had in December, we did not know about the bill. We thought that we had received the final bill for the charges for 2021. Glendale Services issued an invoice on January 14th for services that have in fact been completed and food that has been served to our nursing home residents and our jail inmates. And so we are obligated to pay them for the contract. Whether the board, this executive committee chooses to approve the transfer or not is not going to negate the fact we're under contractual obligation to pay the vendor for the services that they provided.
Thank you, Mr. Chair. Just a quick question. You got the bill on January 14th. I don't know what the bill was dated.
January 14th was the date.
Okay. And they expect you to pay it immediately? You don't have like a 2-week leeway?
The terms are due on receipt.
Okay. Could you have do you always, do you always pay it the same day that you receive the bill? Or on all vendor invoices that say due upon receipt, are all invoices paid the same day?
No.
Okay, follow up. What is your practice?
At the end of the year, we're trying to get bills paid that need to be paid. So regardless of the transfer, the bill was going to be paid.
My question is what is the normal practice when you receive a bill that says due upon receipt? Do you pay it the same day? Is that normal practice for the county?
We didn't pay the bill on the day it was received. No.
Okay.
So no, that's not normal practice.
Mr. Silver?
Sure. By whose authorization was the bill paid prior to the transfer request being submitted to the executive committee?
The Board of Commissioners authorizes all bills.
Sylvia? Why is there no date on approval? And this,
It was approved at the January 6th.
No, last meeting we had last week.
Oh, it's the 20th.
This one.
Okay, commissioners meeting. They did approve it. Commissioners left the meeting before they signed it. It is approved, has been approved by the Board of Commissioners.
so they approved it on,
January 20th.
1/20/22.
it was 5 days after you received the bill. Sylvia was next.
How much was the last bill?
$18,502.04, and it was paid on the 20th.
And how much was the bill for November?
$113,693.81. Those numbers encompass both the nursing home and corrections. That's the total bill going out.
More questions?
Thank you, Mr. Chair. So you got the bill on the 14th. The commissioners approved it on the 20th. They couldn't wait 5 more days for us to approve a transfer request before paying it? I'm just asking.
I think Representative Comtois, the essence of this discussion is if we don't pay the bill, then the residents and the inmates essentially don't eat. It's a food bill, like a grocery bill. It has to be paid on the.
I understand that it has to be paid. Okay,
So you're suggesting we pay it late?
well, you were already paying it late because if you got it on the 14th and they didn't meet until the 20th, it was already late. So I'm just asking why you couldn't wait another 5 days for us to approve the transfer request.
Because we don't pay bills late.
But you just did. It was due upon receipt, January 14th. I'm sorry.
Our check, I don't think you are. Our check runs are paid every Thursday. And so it would be due on receipt, which means on our next check run.
I go back to the same conversation we had with the last transfer request that we discussed during the December meetings, right? So we've operated under the understanding that we had back in the spring that this board would approve transfers for departments when they were going to be overexpended. When we brought them to you, we brought this as soon as we could to you, and we're asking for it to be approved. The fact of the matter still remains, the bill has to be paid, had to be paid, whether the transfer was approved prior or after. It's a matter of timing, I guess, or there can be animosity amongst some of you on the executive committee as to whether we correctly forecasted the right amount, and maybe we would have brought that to you in December, but the fact still remains, this bill was due, had to be paid, and that budget line does not have ample funds to cover it. So
if the committee chooses to approve the transfer or not, the bill still has to be paid, and we're still under contractual obligation to have made that payment.
Well, I'm looking at the billing statements for the year. And we're looking at, 111.5 back in September, and 113 and 113.5. We should have anticipated at least 113 for a final payment. That's what the average has been. And you knew at that point that there wouldn't be enough money in this line to cover that. So I think more due diligence has to be placed on looking at these contractual agreements when they're coming up towards the end of the year. Try to get ahead of the curve.
Mr. Chairman, it seems to me that the payment in excess of the budgeted amount prior to approval of a transfer request violates the injunction of 2014.
I disagree 100%. And this body and the delegation has brought questions and concerns to the Board of Commissioners for not seeking transfer requests for an item exactly like this. So we are bringing forth and following the courtesy and requesting this transfer. Whether you grant it or not, these funds had to be paid, and there's ample appropriation in the nursing home to the tune of in excess, I think, $800,000 to $900,000. So as we sit here and debating over whether you want to approve $29,000 transfer or not, is really a very minute issue that we're spending an awful lot of time on.
What is the total for the year for the food service?
What did we pay? Oh, the total budget?
Total paid.
The total paid for the year was $1,292,100.25.
And that's nursing home and corrections.
Yes.
And what portion of that is?
Corrections is $160,204.20. It's $160,204.20.
Mr. Chairman, since Commissioner Waring seems to disagree with the interpretation of 2014 injunction, perhaps we should ask Judge O'Neill for his view on it. No. This could have been brought before the disbursement was made, and it wasn't. They dispersed before a transfer request was done in violation of the injunction. Simple. I'm not saying that we shouldn't have to pay it, but there's a procedure that's been established. It was a subject of litigation, and they just ignored it.
Thank you, Mr. Chair. And I don't dispute that we need to pay this. Okay? But two things have happened, in my opinion. Is one, based on those numbers, they had a pretty good idea that they're going to need a transfer request by the end of December because they paid the November bill in December, which means they knew the December bill was going to be right about the same based on occupancy. The second thing is that at the beginning, we had a discussion when we were talking about transfer requests. And we had two commissioners that had violated the transfer request, and we were told that that would not ever happen again. And yet we have a commissioner here that still disagrees with what the delegation has set in motion. And so as much as I do not like the fact of going to the judge, I really think that the 2014 decision needs to be revisited so that we have a clear understanding and that going forth, because we were told that it wouldn't happen again. And yet we sit here with a disagreement between the commissioners and the delegation on when transfer requests need to be made.
Yeah, and I'm gonna vote for this, but under protest. So I agree with whether we need to go back and ask the judge for a declaratory judgment on it. I will leave that.
Or a contempt citation.
Mr. Chairman, if I may, it seems to me that the Board of Commissioners, the county administration, have followed all the necessary guidelines and protocols as far as coming before the executive committee to make a formal request for a transfer. So I don't see, or perhaps you could shine a light on where any wrongdoing on the part of the Board of Commissioners has taken place, unless you're objecting to the fact that, so we not allow the account to become delinquent. The county did cut a check and make the food payments. If that's the issue you're objecting to, I can certainly address that.
That is the issue. We said that we would, give you a transfer that was warranted. But then you jump the gun and you make the transfer before we even had a chance to decide if it was warranted.
I would respectfully submit to you, Mr. Chairman, that we made the payment on time so as not to be in arrears with this particular contract.
Representative.
Thank you, Mr. Chair and Commissioner Spanos. I understand what you're saying about the bill. I do. But what bothers me more than anything is that in December, we paid the November bill of $113,000. We knew if at that time we were going to be short in this line item based on history. A transfer request should have been brought forth in December based on those numbers. I mean, anybody that in accounting can see where that was going. Okay? Even if you had estimated at $100,000, $113,000 based on history, you knew that the costs were rising and what they were going to be. And that's all I'm going to say, is that you did not the anticipation, and you should, it's pretty basic because food is essential to our residents.
And then Representative Sylvia also had his hand raised. In Section 4.2 of the contract with this food service company said the operator will submit to client during the contract period an actual invoice for each month of services. The invoice will be provided to the client by the 30th of each month following the actual expenses. The client shall pay the monthly invoice to operator in full on or before the 15th day of the next month.
Which would be February 15th in this case.
The invoices indicate due on receipt.
That's what the contract says. I don't know what the invoice says. The contract says.
So, looking at my budget report from December 15th for the contract dietary services, we have at that point paid $930,837. Encumbered, which presumably is the month of November, $98,230. If one expects that the price of food is not going to go down, one would budget for expect of $98,234 at least, which would put you $27,000 over on the budgeted amount, $27,005 would have been known December 15th. And just
Follow up.
the statute on misappropriations doesn't talk about the need for a transfer. It says that no money shall be spent without the appropriation. This is coming looking for the appropriation after the fact.
Okay, I'll move the question. All those in favor of the transfer? Say aye.
Aye.
Opposed?
Aye.
Motion fails. Get back to business of budget. What? We should pick up the nursing home.
I know. Is that where we're going?
Debt service, I think we kind of discussed that, or do we need anything further?
You went through dietary to nurse, you're on nursing services.
Mark that indicates we finished with dietary.
Go into nursing service. The biggest number in the budget is full-time wages.
Thank you, Mr. Chair. And sorry,
Hi.
just a quick question for you. Just going through, looking at last year's budget numbers and this year's, we've had a lot of vacancies. And now with the new Supreme Court ruling, how is that gonna affect your staff? Are you gonna lose more people because now they're mandating that they have to get vaccinated? And if so, how many people are you gonna lose?
Actually, we're down, the whole facility is down to 11 people now. We were at 35 not vaccinated. Now we're at 11. We have,
11 not vaccinated?
yes, I can give you the breakdown. We have 6 in nursing, 3 in dietary, and 1 in activities. We have 11 exemptions right now, 1 medical and 10 religious. So they're not vaccinated, but they have exemptions, so they're not counted as being unvaccinated. For that purpose.
Okay, so these 11 have exemptions,
11 others have exemptions.
but these 11,
Have not done anything yet. They have till February 14th.
Right.
And then March 15th. So if they get 1 shot or 2.
okay. Follow up, Mr. Chair. Thank you. What is the consensus regarding them? Because I know at one point you said you're gonna lose at least 7 of them because they were gonna absolutely refuse to take the vaccine.
I don't know where these left are gonna be. We've been trying to educate them. We've been trying to talk to them about exemptions. I don't know what they're gonna end up with. Some of them bring you right till the day before. That's what they did last time.
No, I'm just concerned because obviously
Yeah.
it will affect you terribly.
Absolutely, because last time I was looking at maybe having to transfer 19 patients
Right.
out of the building because we did not have enough staff. We have 4 agency nurses now that are here till, I think the last one is here till April. That will help us, but we've got people that are gonna be going out on maternity leave. So building the census is gonna be tough. Plus, if we do lose anybody else to the vaccination.
So
So on this mandate question, is CMS talking about a third shot, otherwise known as
The
boosters?
booster, yes. They're talking about revising the definition of fully vaccinated and make it up to date. So up to date means you have the 2 shots for the J&J and you have 1 booster. But they have, to my knowledge, it hasn't come through yet. Right now, it's just gonna be the 2 shots.
And you have other nurses who have been fully vaccinated who are not going to have further injections?
Correct. I have heard that through some people that they don't feel comfortable taking the booster.
And how many nurses would that be?
I think that out of that 60% maybe are not gonna take the booster.
Is CMS going to question any of the exemptions?
No, the state survey team said when they come in, they just want to see that they have an exemption on file, but they're not going to be reading the rationale to why they received an exemption.
Thank you. So 60% of your current staff said they would not take the booster. And because I'm going to make an assumption, and I really need to ask you this question, because they've already taken the original vaccination, or the original shot, they cannot apply for an exemption because it's kind of a moot point at this time. So what would happen if they require this booster? I mean, because they're talking that the booster would mean you are up to date and you can receive Medicaid and Medicare funds, because obviously we wouldn't be talking about this if it wasn't for the Medicaid and Medicare funds that the nursing home takes. What does that do to our residency, and what does it do to the people that rely on the county? Yes.
We would be in trouble. We would be looking for other facilities. If we don't have enough people to take care of the residents that we have. Yeah.
And unfortunately, the other facilities aren't taking.
And
anybody
I was
either.
gonna say that's a huge issue everywhere, because it's not just gonna affect us, it's gonna affect St. Francis, it's gonna affect Golden View, it's gonna affect every nursing home. So
That's why
where
the
are people gonna
hospitals are
go?
overwhelmed, because the hospitals can't move these people
Right,
to nursing homes.
I don't know if they would look into making the booster, revisiting that and making it some type of exemption.
Because once you take the
Right,
shot,
you've taken the shot.
right.
But people have changed their minds because they've seen now people either side getting COVID.
Mhm.
So some people that did take the shot previously have decided they did their part, or they don't want to, they've seen people get sick even though they had the booster and they don't want to do it.
Did you have a question?
No, that was it.
Representative Silver?
If the 60% you indicated depart because they will not take the additional booster, what will be our capacity for a number of residents we're able to serve properly?
When I say 60%, I'm thinking nurses, LNAs, housekeeping, maybe dietary, like everybody.
Right.
I'm not just saying
Right.
the
No, I
60% of the nurses. We,
So do we end up that we can only serve 5 people or 15 people or 30 people?
maybe
What's-
15 people, maybe 20, 15.
And the current
max.
status and the current census is?
60.
Based on all this.
Well, and that's the question.
Better get it right.
That's what was our original, we did this a couple of times. Because how do you do a budget when you don't know what we're gonna have for staff and what we're gonna have for census? And we have things that we're gonna pay, because you have to, that's the price for them, regardless of having 2 patients or 90 patients.
Right.
You know,
Mhm.
it's very difficult.
Thank you. When we move a patient to another facility, if we can find another facility to take them,
Yeah.
do we have to pay that other facility?
Yes, in the Health and Human Services line.
Yeah, $6 million line that we have no control over.
We have no control over
It
that.
wouldn't be immediate. Representative Silver, it wouldn't be an immediate exchange. It would come back around when the state back bills the county and county resident that is in a different nursing facility.
Well, just so I understand the conundrum that you're facing here. 60% of your staff, nurses, LPNs, et cetera, 60% will not comply, they leave. We can't continue to pay, we can't continue to have them on staff, is that correct?
Right.
Okay.
Or we won't get CMS on
We
it.
won't get CMS. So they will leave, and we now have a large number of residents in the nursing home with insufficient staff to service them. And we have trouble, what do we do with the excess residents who need the services that we cannot provide? And we can't find a place to put them.
This
I
is
had
what we're
that,
doing all day.
I
while
had
we're
that
not
phone call with
updating
the state,
projection.
with the commissioner. I thought, that's why we have the National Guard working. We have one person
Well,
from
are
the
you
National
gonna
Guard
put these
working.
people in tents somewhere?
Nobody has an answer.
Nobody
We've met
has.
with the Commissioner of Health and Human Services. We've talked to everyone we can talk to. Shelley's contacted all the other nursing homes. They're all about a month behind us, it seems like. When it's hitting the fan for them, they're saying, you know, what are we gonna, nobody knows. No, there are no answers. Nobody knows what the answer is.
Follow.
You follow up. Of the 60% that are gonna depart because they won't take the shot, if we increase their wages, we're talking about the budget now, we increase their wages, you think any of them will stay? Take the shot and stay?
I
really don't think so.
I
Impossible to answer.
I
those
know,
things.
I have no idea.
That's a question of whether they are willing to blackmail us or not.
That's
That's
exactly
what it
right.
boils down to.
That's exactly
You
right.
know? The next thing that's an issue that we're starting to see is vendors, people that come in and service us, because vendors have to be vaccinated too. So when we have somebody come in to service one of the pieces of equipment, or maybe the heat system or the water, or the septic pipe or the boiler, the gentleman coming in, we ask them if they're vaccinated. If they're vaccinated, then fine, but if they're not, we test them. If they're positive, then they can't work, and they go back to their company and tell them they have COVID and they can't work, and that owner is upset because they lose a worker. Because we've already done that. We've had to test people, and so now the guys will come and they'll say, we don't want to be tested. Our boss told us, no testing. And I said, I can't let you in. Either you're vaccinated or you take a test. So that's gonna be, we're gonna end up paying higher prices for people that are in the business world to come in and service what we need done.
Follow.
When you get vaccinated.
Yeah.
My understanding is you get a vaccination card
Correct.
that gives the date
Yes.
and the type of so-called vaccine that you got.
Yes,
Do you get those and copy those for vendors, people who come in?
we ask them. They don't have, they just have to answer the question.
You don't ask for
Some
proof?
feel free showing it, but we don't take copies.
So,
Where's that come from?
thank you, Mr. Chair. So even if they say they're vaccinated, is the next question gonna be, have you taken the boosters? Is that coming down the pipe?
I don't know.
Maybe our
It-
question
it-
will have to change to, are you fully vaccinated?
Right, or are you up to date with vaccination? Because if that's what they're changing the phrasing to, that might be what we need to put down on the attestation form. Are you up to date?
It's just,
But then it's Sylvia.
I don't suppose we can work our way out of this by cutting the revenue line from Medicare to Medicaid and skipping the nonsense that all of our patients are. for Medicaid for the most part.
85%. At 85%,
85%.
yeah, at
We
least.
probably pick up a good amount of private pay.
We looked at, what about changing to an assisted living facility, but the reimbursement is lower? Because then you wouldn't have to deal with some of the CMS regulations.
Someone was telling me that Genesis, that has bought up all these facilities, are only doing rehabilitation now. They're not taking any long term. Because they just want the big dollars to come in, rehabilitate. Clear up the facility and bring in the next.
That would mean all your residents would have to go home. Nobody would stay there.
Yeah.
Because you wouldn't have a long-term care.
That's, they're just exasperating the problem we're having because they're not taking any long term. They've bought up a lot of the facilities.
We didn't have to rely on Medicare, Medicaid. If we told them thanks, but no thanks, we don't need your money. And we were we'd be the only medical facility probably. And then we could get all the staff from other places who are gonna quit and it might not be bad. I don't know how much.
Well, it's kind of like privatizing,
Private.
Yeah, right.
a hybrid model.
We'd
of
have to
it.
raise the taxes. It'd be
You'd have to
very
Right, it have to
expensive.
have to be funded through taxation.
That's right.
Thank you. Because I am noticing, and I know this is gonna sound really odd, but people are willing to work for less if they know they don't have to be vaccinated. I'm just gonna throw that out there because that is happening.
Send them here. We haven't seen.
Yeah, but the thing is,
Send them over.
you require vaccination.
Not
Well,
yet.
but we didn't,
Not yet, right.
we didn't for a long time.
Right, but I'm just
And
saying,
we
I
didn't
It's
get
coming, yeah.
an influx of staff.
I mean, there are a lot of people that are willing, they're looking, want to go somewhere, but, and then will work for whatever, just so they don't have to follow these mandates.
And a lot of people are leaving healthcare.
Right, because of the
Because of
mandates.
So
Used to be a legislator from Nashua, it was Pete Silva. So good thing he's
that's
not here.
just what I need.
So I guess getting back to the budget, and this is the biggest line anywhere in the budget is full-time wages for the nursing services. Couple of issues that we, the wage increases that they are getting, will be getting. I can argue that. One of the problems with that is if we pay very well, we're going to be just golden. So we need to think of the whole county, not just our operation. And I know the commissioners also consider that when they're trying to set their wages. I know everybody's, we're all in the same boat. We have so many unknowns coming. I think that somewhere along the way, once we set this budget, it's going to be subject to your review. Because we're really this is probably even more guesswork than it was last year with. the
Like
drama.
why?
So having looked at the historical stuff, I would make a motion for wages of $2,750,000 for full-time.
I'll second that.
Having a second, I'll just say that is the highest amount that we have approved. It may be plenty if we don't have nurses to pay. It may be insufficient if we have all of a sudden a lot of nurses that want to work and we can fill vacant positions. I rather doubt it, but I'll admit this is, in the land of spitballs and the best one that I can come up with.
Silver?
Mr. Chairman, we talked about a mid-year review. I think perhaps we should have a review in the first quarter, end of this first quarter.
Well, I'm not talking about, we always have reviews.
Yeah,
I'm
okay.
talking about perhaps a supplemental appropriation.
Understood. Okay, yeah.
Okay, so we have a motion and a second. I'll call for the vote. All those in favor?
Aye.
Unanimous. On to the next new line, incentive pay.
That was just to make it more transparent for the incentives that we're doing, because the incentive pay used to come out of full-time wages, right?
The incentive with the incentive pay isn't part of the premium pay, right?
It's like when somebody picks up extra shifts, does a weekend, gets mandated, maybe switch their shifts for 3 months and got $3,000, or worked the 4-week incentive, not calling in sick and picking up 1 shift extra a week. We have like 6 or 7 different incentives that for staff, for nursing staff.
Now that 150,000 on, is that calculated on full staffing? Or what percentage of the staffing is that calculated?
Actually, the way it's calculated is we looked at what did we spend in 2021, which is almost $90,000. And that doesn't cover the full year because we adopted these incentive plans during the year, on a staggered basis. So it's a guesstimate looking forward, maybe for a full year, we might need 150,000. It's not a,
If we're full staff, then that would most likely diminish.
Be
correct?
less,
that's right.
be less, because we wouldn't have to do the incentives.
So to your point, if we budget based on full staffing at some point, that would certainly be less than.
Just, a boomer comment. My thought was always that the paycheck was an incentive to go to work. I understand that we need to add things on, but I don't like the term.
Yeah. Comments on
I'm trying to follow the incentive pay on here, so. Is it part of this wage schedule?
I hope so. On there.
I do, and I was playing with. Well, I was hoping that was gonna come in.
do we treat this the same way Representative Sylvia looked at full time, the possibility of a mid-year realignment of the budget? And if we do that, we could reduce that number somewhat and deal with it during the realignment. I don't know, I just think there's more tax money than we need, but how do you know? So,
So I guess I have a question for the commissioners with the wage compensation study going on and hopefully having that done in May. Would this be rolled into the solid wage structure, or is this going to remain a separate?
Take a shot at it.
I didn't know that question.
So my anticipation, I guess, would be, I think it's more connected to our level of staffing than it would be to the wage rates. Right, so the wage rates are gonna be what they are, but if we have still excessive vacant position, then we still might have to incentivize folks to pick up additional shifts outside of their regular work duties.
Thank you.
I have a question relating to after the study's completed. There were to be adjustments made in wages. Would that require new contracts and approval by all sides?
Yeah, that would need to open up negotiations with the collective bargaining agreement associations, for sure. I don't think they would say no.
I know they wouldn't say no.
Yeah,
it's
but
just,
absolutely.
They still have to sign off
Yes,
on it
they
though.
would still have to sign off on, as well as increased costs would have to be approved by the full delegation.
when Zoom comes in.
Thank you, Mr. Chair. Maybe I got confused, I'm confused. But I thought you already went back to the unions and renegotiated the wages.
We had an end of year adjustment. Yes, we did.
So based on what the delegation approved for cost items, you renegotiated that and did not bring it back before the delegation, correct?
My understanding was that those costs were still already included in the budget figure that we had. Is that correct?
Well, let's follow up.
Oh,
Yeah, I was told that they were not. And that we were just hoping for the approval of regular numbers so that it would include the increasing cost items.
There was we went back and negotiated with the union on this wage increase. And it did increase the cost of these wages for union employees.
Let's follow up.
follow?
Yes, and it is my understanding that those costs were not included in the budget that we received. Is that correct?
Oh, they were included in your last meeting or the meeting before, I can't remember.
Right, but the original budget that we're going by.
That the original budget handed to you early in December did not have them in there. But the commissioners had discussed before giving these wage increases, is there enough money in that budget proposal to cover it? And that answer was yes. And that's why this column B here, the nursing home wages, is showing you if you could pull those wages, it amounts to about $90,000 out of full-time nursing wages and distribute it throughout the nursing home divisions. That was what we were hoping you would be discussing here, and that you would, I think it amounts to about a reduction of 90, it was about 90,000 or 91,000. Now you've reduced it far beyond that, so please don't do that. But yes, so the money, there was enough money in there to cover it. With the number you're looking at now, the 2.7, I'm sure there's still enough in there to do it. It just won't leave us as much to try to recruit.
But I think we still have one problem.
Yeah.
This was approved by the union, by the commissioners. It wasn't approved by the delegation. So that's a breach of contract. I would imagine. I don't know, I'm not a lawyer. But you know, when a party is not involved in under the legal obligation, it's a breach of contract of some type. I just, you know, I know there was money in the budget to pay those extra costs, but those extra costs are part of a contract, and that contract was not approved by the delegation. And that's what I have a problem with. I'm not saying that the delegation wouldn't approve it. They probably would have, but the fact that they were cut out of the decision is, I don't think it's a good thing. It doesn't set a good precedent moving forward either.
Check into that, I'm not sure.
Well, I'll make a motion to reduce incentive pay to $100,000.
Discussion? All those in favor?
Aye.
Opposed? Unanimous. All right, part-time wages.
Huge
Do
increase.
we even have
More than double.
any part-time left?
More than double.
Yes, actually, well, I have 7 part-time positions open right now, but
How many
7.
part-time positions open?
Positions do we normally have? I'm just thinking with this shortage, all these part-time people, I'm surprised they haven't moved to full-time just to take advantage of all the incentives and benefits.
Actually, we have a lot going the other way. Our full-time, we're more worried that our full-time employees quit their full-time positions and take registry positions. So they can pick and choose when they want to work, and they also get a little higher, they get higher wages.
But they lose the benefit.
But they lose the benefits, but they
I'd rather pay
they have
higher
the
wages
people
than
who
lose
don't need them.
benefits.
So they're saying, no, thanks, we'll take the higher cash rate and pick our schedule.
Right.
So then you gotta-
Yeah, so the historical trend on this has been declining.
Yeah.
Strongly declining, so. Suggests that not a lot of part-time help available, or just not being used that much, I don't know. When we started out in 2015. $1,000. Yeah. Last year projected at 340. This year. So this is trending down.
Is there a motion there? You need to
I have a question.
move along, yeah, it's, this is all a
Yeah.
big guessing game, so let's
We're
just
flying
try
blind.
to guess the best we can and keep the process moving.
I'll make a motion. I'll move $500,000.
I'll second that.
All those in favor?
Aye.
Unanimous. Overtime. Overtime and incentive pay, are those pretty much closely related now? Or is it overtime plus incentive?
Yeah, no, they're separate things.
Yeah.
Comments on overtime? To sick time incentive. So wait a minute, so skipped over. Go. See any motions on that item, so we need.
have a number on that?
Yes,
Exact.
I put it up there. It's $3,674.
I'll make a motion to attend the center of $3,674.
So
3674.
Yes, sure. That's a 600% of line.
Right, and that's an exact dollar figure that won't go over anymore.
Longevity award. Like we're having trouble with longevity, so I don't know why we're getting.
I don't know, I've
Yeah,
been
this
here
is-
16 years.
Yeah, Shelley, you're
I
great.
get the longevity.
All right. Seeing no motion. Wages office.
It's for the business office and the nursing home.
Yeah, the nursing home, the DON's administrative assistant, she also does scheduling, the unit clerk and medical records.
I'm assuming at that number, it's a full-time,
3 full-time.
full-time. Yeah, so,
Yes.
health insurance, next big number.
So it's something we can calculate from reductions in wages.
Well, it's kind of a hit or miss because it's how many people, I guess you have to look at how many vacancies are there in this department.
What kind of plans they take?
And what they have slated for the health insurance based on this sheet here. Well, you don't know what they have for health insurance. But you know, you have, what, I don't know, you have 7 people, right? At $30,000 a year on a family, that's $210,000 reduction right there.
We just hope we don't fill them.
We can-
But I'm just saying.
Yeah. Well, that's another item that we'll probably have to address come to mid-year. I would entertain a motion of level funding from projected year end.
No, I would probably go 1250.
250.
So
What line were you?
Yeah, health
We're
insurance.
gonna- Sylvia, second.
I understand. Second, who, Representative?
Me.
Thank you. Sylvia.
Further discussion, no. All those in favor? Yes. No. Payroll tax is something that could be
It's pretty easy.
calculated.
And so we just reduced, let me just. Yeah.
Yeah.
So reduce it by 55,000.
I'll do a nice 280.
275.
Second.
Motion and second at 275.
Payroll tax.
Federal tax, yeah. Who made that motion? Did I make that motion?
You made the motion.
Okay.
Sylvia second.
70, yes.
All those in favor? Unanimous.
On which line are we looking at?
Payroll tax.
Okay, all right, that's thrown out. It's been a long day.
Just want to throw this out there. I was reading some bills the other day before the legislature, and one of them has to do with retirement. They're trying to tinker with the increase to the benefits. And the expected increase if one bill passes for municipalities, they can't break it out, but municipalities would be $140 million in 2023. I was a little disturbed to see a couple of our delegation members as co-sponsors, so I'm gonna have a chat with them. You know, we just got hit with a big increase. The last thing we need is another one. Especially the way things are going.
No.
But anyways, I got sidetracked with that, but
Question on the retirement. Technically, we could reduce that by the 14.06% based on what we reduce the full-time wages. Do you also pay that on incentive pay?
Yes, and overtime.
Right, but not part-time wages. So we only reduced full-time and incentives, so whatever we reduce that by, we could reach. Okay, I got it. All right. Bear with me. So if you make it 440,
Motion.
so 440,000,
Second.
that was 440.
yeah, it's a little bit under, but yeah.
Sylvia. Employment insurance,
It's minimal dollars. I wouldn't even
Yeah.
worry about it.
we don't know which one.
There won't be any this year. Those are the numbers.
Workers' compensation. That's based on previous years.
Question.
Question. So,
When someone from our full-time staff decides to go through the registry, go so they can pick their time, does the registry require them to prove vaccination status?
What now?
It's not a separate registry.
it's not a
It's just what
separate-
we really call these part-time employees. So there still are.
It might be
employees.
called on-call, like an on-call nurse.
So
or
it's not
per
through a
diem.
service. It's not through a service, it's through us.
It's through us.
So the vaccination status is still an issue. Thank you.
But the next couple of, well, the contracted nursing services,
We've been requesting that they're vaccinated.
we still have to verify their vaccination, even though they're not our employees. But I think it's if anyone who comes in the facility, is that?
Yeah, it would have to be
Yeah.
anybody.
Any, yep,
And if they don't
Any
provide it, you have to
vendors,
refuse them
any-
entrance.
activities, so a vendor, somebody that's doing an activity, a performer,
Unbelievable.
everybody needs to be vaccinated.
A county administrator
A
that can't
county-
go in.
Yeah.
Visitors.
No, visitors can come and go.
okay, so we're on recoup.
So contracted nursing services.
Maybe we should reclassify some of our staff as visitors.
That would be, that's a good idea. That would be good.
So recruitment was,
LNA class and med tech classes. So we try to run 2 a year and we try to put 6 LNAs through at a time. Sometimes we didn't have enough people, so I opened it up to other, like Golden View, St. Francis, so that we could make 6. and be able to have enough for the teacher so that she would continue to do services here. We ran 2 classes this year and we were able to get 6 students out of it. We have 4 students left. 2 other students had done their, have moved on.
So we paid for their training and they left.
Pretty much.
Yes, but we now can get third-party payer. They passed a bill at the end of September. So now if I fill out the paperwork that we put them through a class, we can get reimbursed for the class. So I've been doing that for
In some
everybody.
cases, they reimburse us. We request
Oh,
them to
yes.
pay us back.
Yeah.
And so it's not some cases.
Yes, if somebody leaves that under a year, then they need to pay us back.
Their new employers have had no hesitation to just pay it.
Yeah,
It's well worth it for them. They'll pay our $1,500,
yes,
whatever.
other facilities have paid.
Shouldn't,
No, they need to be vaccinated before they join in this program.
Yeah.
I want to make sure that.
Yeah, everybody now is, we held off as long as we could. And now we can't.
It is really, the only crazy thing is when they allowed visitors to come in without. So it's so locked down, but if you want to walk in there and visit, no problem.
You know, all this legislation,
Can you fix that?
no, there's legislation to the person in the facility can request someone to come in. We can't stop.
Yes,
That's how that bill
Yeah.
will
Oh,
work.
oh, the patient's bill of rights.
yes,
Patient civil rights. Too many people pass away without a loved one.
yes.
Can't, we can't continue that.
We've never done that. We've allowed people to come in for compassionate care visits.
Well, we did, but some facilities.
We always did. If we needed to gown somebody out or whatever, we always let them come in.
All right, so we're leaving recruitment alone. Moving on.
Do you believe, I just have a question, Mr. Chair,
Question?
on recruitment. Do you believe you're gonna be able to hold all those classes and you'll have enough students?
I'm trying. Anybody
Hold on.
that says they want to do anything with health, I recruit, well, I tried recruiting Mike.
Well,
I
I
try
don't
all
think
the time.
he qualified.
I try, and anybody that's an LNA, if they want to go further and develop into a med tech, I try that, because that class is 4. And we've actually been working really good with St. Francis and Golden View, trying to make enough people so that we can hold a class.
Thank you. Yeah, I'm sorry, Mr. Chair.
No, that's all right.
Although, that's one thing you guys could probably do, is get us reimbursement for the med techs. They don't reimburse us for the med tech program, but they do for the LNA program.
But isn't the med tech one step up because now
Makes no
they
sense.
can dispense medicine, right? That's why we want to train our
So if we
LNAs.
could be a third party payer for that, that would be great, because we could get reimbursed.
Makes no sense.
Does anything make sense?
Find some bill we can tack that on.
Right, non-germane.
Like the
Yeah.
Senate.
Yeah, right.
Okay. Moving on. Play recognition. Okay, contracted nursing services, that's the next big item. Representative Sylvia, you have.
Yeah, so
your notes.
I can understand why this one would be high, but I don't necessarily understand why $220,000, which looks low in the scheme of things. How does that happen?
Probably because our census is low, so we don't have as many contracted nurses and LNAs. We haven't had contracted LNAs now since October. No, November.
And their actually year-end projection is 195.
It's just gone down. So
Is that because they're just not available? You know,
That's
there's
part
such
of
a high
it.
demand for
That's
them.
part of it, and a lot of us have been working.
And, you know, what they, you know, they're scalping people with the pricing.
Well, we've lost nurses to some of the strike teams because they're paying between $200 and $300 for a nurse. And agencies, yeah, it's going to the highest bidder. I don't know if you read in the paper, they do have the buttons where they say, you know, it moves up the price. When I call and ask for an agency staff, they'll say to me, how much are you willing to pay?
It's legal price gouging right now. I mean, if a gas station attendant tried to raise his prices like that, he'd be thrown in jail, but we're letting them get away with it in the field.
Can you put a cap on it?
I wish.
I disagree, but make a motion.
Okay, take a motion.
Once again, I think this line is a little bit of one of those spitballs, so I'm gonna go with 300,000. This is contracted nursing services.
It's time.
Second,
Are you,
she's
back
working
with
on it.
this, Madam Clerk, or,
No, I'm not right now.
no, okay,
Something happened and then let me look after that with something. God knows what I did. Sorry about that.
You can just watch the video and re-enter everything.
Are you kidding me?
Yes, I was.
Remember that. It's been a long day. Okay, we're back.
okay, okay.
So
we have a
Sylvia's
motion and a
motion,
second.
Silver second,
On that.
300K.
Silver second.
Contract nursing services, correct?
Right, with the understanding we're all flying blind.
Oh, that much I do know.
All those in favor?
Aye.
Unanimous? Next line, medical supplies. Question is,
Medical supplies.
moving on. Oxygen.
A question,
Representative.
if our census is down and is spiraling downward, how can oxygen pricing be going up?
Well, we got increase in bulk deliveries, in hazmat, in tank rentals. And this number I came up with on a census.
For full census?
For, yeah, having 94. That's what a lot of it was budgeted on, having a full census of residents.
I'll make a motion.
What's your motion?
I'll make a motion that instead of 41,787, we do $22,000.
Ooh, no.
You do like 20.
Please reconsider,
28?
Representative
Yeah,
Silver.
that's
28?
Yeah,
Yeah.
that's 2/3.
28,000.
No,
It's still less
Oh,
than we
sorry.
spent this year.
Okay.
What's the consensus here?
Do I have a second?
39.
30? 30,000. 30,000.
That's what you get paid for.
This is a good one for headlines, by the way.
This is.
I know.
Yeah.
Who did the second on this one?
We fielded a lot of headlines last year.
I guess I'll second it. I'll second it.
Okay, so I have a second. What was the number?
30,000.
35.
All All in favor?
Aye.
Opposed? Okay, so 3-1 motion passed. I'm sorry.
Who
did I
said
cut
no?
you off?
That's fine, yeah, I was just gonna ask you to reconsider the 30,000, because
Well-
it's 3,000 more than we spent this year, and we're planning
We're
to
trying to-
increase the census. So all things being equal, even if we maintain 60 residents, we're going to be more than 30,000 anyways, so
Well,
we're already behind the 8 ball, day one.
Mr. Chairman, the optics of going before you for a transfer request on oxygen of all items is really not a good look for any of us here in the county. So we ask that you reconsider that line item.
well, we are inevitably going to be doing a midterm adjustment. And, be one of the items that will
And-
be adjusted if needed.
Right.
That's,
Yeah, and I just like to say, I mean, right now, we're at 2/3 capacity. This was budgeted on a full capacity. And if those mandates come in and we know that, we could lose up to 11 more people out of this department and possibly an additional 60% of our staff due to the booster being part of the mandate to get our monies, all of our expenses are gonna go way down.
except for
And so will the revenues. The revenues will,
Correct.
so there's going to be a correlation between the two.
Correct.
But we will have one line going up, and that will be for the residents that have to leave this facility, and we're gonna be paying for them in another facility.
Right, but so we're at a guessing game. Everything is here at a guessing game. And I do not believe that we will be at full capacity anytime during this year for residents. I just don't see that
I
happening.
hope we are, and we have to come back mid-year and adjust this budget. We really,
Well, that would be a win-win for everyone.
so. Right now, I can't see budgeting more than we really think that it's gonna be the reality of the year moving forward. Anyways. The vote was 3-1. We go to that.
I did, Representative Sylvia voting against it.
Much as I like the headlines.
Yeah, you got crucified.
They're just trying to say you're redeeming yourself over some foolishness. Uniforms. Now, there again, it's a small number. If we're only, we're down 37 staff, we really need all that money for uniforms, but. What is this another common allocation? What was that?
For credits, essentially, if we transfer things, supplies from the nursing department to another, if the jail needs Band-Aids or something.
Well, that's something that happens occasionally.
Yeah, it's very minor and insignificant, really.
Nothing in the new equipment. And that kind of wraps up the nursing services line items. Do we want to,
I'm checking my number to see
you want to look at the final number on that one now?
So I've got 6,341,11.
634111111.
$6,341,111.
Yeah, 41,000.
Okay. All right, moving on to laundry.
Laundry's fully staffed. We have three full-time employees.
It's awesome.
They're
They must have an easy case, I mean, what, the staff are going in.
We pay them by the piece.
One third less work. Anyways. Does anybody have any issues with full-time wages?
I'm gonna get that for you.
Can we go home and we start over tomorrow? No.
Only if you're inoculated. Well, I had it, so January, so. Sure.
She said. Cannot figure out when she did it. We did the right button, that would be good.
Have any motions on full-time? Seeing any of them want to overtime?
Which one are we in now?
Laundry.
Question of, so
Do the laundry workers have to be fully vaccinated?
Yes. Everybody that works in the nursing home has to be, whether they're a contract, like our therapy services or our dietary. Everybody that works in the facility. Receptionist, housekeeper, maintenance.
any other question on any of the line items you want?
Maybe just one more question. So when the commissioners or the department head look at this, is this considering staffing or
Full
population
census.
as it currently is or full?
Full census.
Well, what is here is
Yeah, I was gonna say,
driven
but-
by the census.
In this department, it's pretty much a fixed cost.
Yeah,
right?
whether you have 40 people or 90,
Maybe-
that's
maybe
what
some-
it's gonna cost.
Maybe some supplies
Yeah.
would. be
Supplies
reduced,
might be less or,
Might be a little bit less.
Yeah.
So it's
Why,
primarily all
when it's
personnel.
not going through as much.
Yeah, those are the ones I was looking at.
Yeah.
Linen.
although I did go through all the linen and had them get rid of stuff that was ripped, torn, discolored. And then we also had to set up a COVID unit with linen on it.
Okay with moving forward. Housekeeping. Giving any motions on any line item. Laundry. So, full-time wages, housekeeping, are we fully staffed?
We have 5 full-time that's fully staffed. In part-time, we have 2 openings for 32 hours. We have somebody that is starting, and we have somebody that was starting, but they didn't show up.
But with the reduced workload on housekeeping, having that part-time person really detrimental.
Actually, housekeeping has to do a lot because they're always infection control. We're always cleaning. They have to be cleaning everything. The I mean, really, when you have visitors in and you've got infection control practices that you have to maintain, they're cleaning constantly.
But we have a lot of empty rooms, right?
Yes, we have 30 empty rooms, 30.
So that's quite a reduction in cleaning. 30 rooms.
The common areas
The
need
common
constant
area.
disinfection.
Actually, housekeeping seems to me is so busy because we've been asking employees from other departments like laundry, if in their spare time, they'll go help housekeeping.
Mhm.
Even with 30 empty rooms, we've asked them to help go through those rooms, but fine tooth comb, trying to keep them busy.
Right.
Because
And
although
we-
our census is low, we certainly do not want to be contemplating layoffs at this point. We're trying to build the
Right.
census back. So anyone who's not straight out right now, we're trying to find something else for them to do. Go help, and housekeeping happens to be where we need the help right now.
Right, I was gonna say, and we have designated visiting areas, so the family room, the sunroom, they constantly have to be cleaned after a family is visiting or a resident is with somebody visiting.
So I'm looking at the history and the projected for 21, I'd move $5,000 part-time.
Also,
5 on part-time. Further discussion? Those in favor?
Aye.
Unanimous?
we should start.
So
Think
should
of
I, yeah, I was gonna say, should
They're
I
not
stop, only fill one position?
Yeah, especially if you're using laundry to help, keep them busy.
What happens when we go to a full census and
So how many vacancies do you have right now?
in housekeeping?
Part-time.
Part-time, we have 2 vacancies.
Okay.
When you said it started or not?
One is gonna be starting.
One,
That's just one vacancy.
No, well, there's 3, I'm sorry,
Oh,
there's a
okay.
total of 3.
so how, and one's gonna be starting when?
He just had his physical and drug screen, so he'll be doing his TB test next.
So, okay. So just a comment, so right now we're down, right now you only have one part-time person.
That will be starting, yes,
Right now you have 0 part-time people,
correct,
and you have 1 that's gonna be starting,
yes,
so you still have 2 openings,
correct.
right? And if you don't, I mean, we're not talking even a full salary part-time here that we're reducing this by. So if you were to hire, if you found people, you should have money in your budget for that. Based on these numbers that I'm looking at.
And we also know the full-time people that we have, there's not enough money in this budget as you're considering to pay them.
Well, I don't understand why. I mean, I'm
Oh,
looking at.
Because we told you they got raises, so it's gonna cost $207,260 to pay the full-time people. I know you don't like it, but that is the number. That's what it will cost them.
Mr. Chair, may I just point of clarification for, so
Go ahead.
I'm trying hard to understand the budget, okay? We got a budget, we were told these were the numbers. It's my understanding that the union wages were renegotiated. However, the contract was never brought before the delegation. Therefore, the contract is not in place. Is that my understanding? Or how does that work?
That's how I would look at it,
Thank you.
but I'm not a lawyer, but regardless, my budget report, granted, it was an older one back in the end of November. But that budget report was full-time for $195,280
That is correct. That's
by the
what I have.
commissioners approval or a recommendation. And now we're being told that now, oh, that's not the right number, the real number is 200 something. You know. I'm not sure, do I have a motion?
Yeah, I think, yeah, we have motion by Representative Sylvia, second by Representative Compton to approve $55,000 for part-time.
Passed.
Okay. All those in favor?
Aye.
Unanimous.
Mr. Chairman.
Representative Silver?
So even though our budget sheets show 195, 280 in full-time in housekeeping, we know that by a contract, it wasn't bought before us, it's over $200,000. Is that right? So we know right away that this number is not right. So what do we do about it?
I consider an automatic cut. Representative Silver.
I don't know, but guess that there may be vacancies during the course of the year. As people come and go. Single year housekeeping staff is certainly part-time. Pretty solid. So just because it sits less than fully funded doesn't mean that every employee is going to be on the books all year long.
Mr. Chair, we've been going through this budget since December. This is the budget book. This is the budget that we were handed to go by. I don't think that changing budget numbers or finding out midstream as we're going through the budget is a good way to do business.
You know, well, our responsibility is to review the commissioner's budget as presented to us. This is what was presented to us,
That is correct.
and that's what we're reviewing. I'll try that, I don't know what to say. So, moving on. Longevity award, wait a minute, the healthcare. Which one is it that we know the fixed number now? Is it the longevity award?
Sick time incentive, and they don't have any.
Sick incentive, they don't have one. Okay. Have to deal with that one. Health insurance is the estimate on full, just on the full three, the full-time employees, right? Just part-time don't qualify for any.
And you have
Five.
five.
Well, 4, because we have one off top.
No,
we don't.
no.
No. Five people.
Oh, I'm sorry, I'm too far away. My lines. Payroll tax. Do we need to adjust that for
We do.
$9,000? Getting a nod from my clerk, so.
So we reduce it by $900. Which is 19,450 would be fine. 9,450. I'll make a motion,
I'll second that. What's the number again?
19,450.
All in favor?
Aye.
employment. Operating supplies. Question on that number? We'll go to next line, uniforms. And then new equipment. That's the broad one. Housekeeping, you have a new bottom line.
429,973. It's great when computers agree.
429,973.
Okay, nursing home position, pharmacy. Pharmacy is slight increase over actual. So do we? How does that work? Do we calculate?
So, yep, so the medical director, we pay a stipend of $1,500 a month for 12 months. And then Health Drive gives us services for podiatry and vision. And it's $300 a month for that. Last year, they didn't charge us for a couple of months because of COVID, because they couldn't come in. So they didn't charge us the 300, so that's why you see a price difference.
So that's kind of almost like a contracted service. Same
So
way
that's
with the
it.
drug review
So that's a definite amount. Those are the-
and medicine.
What accounts for the 50% increase in drug review?
It was $10 per person for a drug review. It's now $13.50.
And this is based on full.
94 residents. And in that number, I didn't add, because I know we don't have a full census. So it was the 1350 times 94 residents times 12 months, which was the 15,000. But I figured we don't have 94 residents, but every time a resident goes out to the hospital and comes back, they have to have a drug review. So that costs us money. And if we're trying to grow the census, every time that we get a new admission, we're gonna have to pay for that. So that leftover money that's in there would cover that. And we wouldn't have to guess at how many admissions we've had.
So if you were
Does that
really
make sense?
operating at full throttle, this
Yeah.
would be. a
I
bigger
probably
number.
would be a bigger number.
Okay. Next line, dentist.
The dentist, we're in a contract with the dentist, we pay $1,500 a month. The contract ends in 2024. We also put in $5,000 for oral surgery, x-rays, or extractions that we need to do that we're responsible for Medicaid residents.
Is there reimbursement for that?
No, I try to put in.
I thought Medicaid would do extractions but not fillings or something.
No, Medicaid will do it outside, but when somebody comes into the facility is responsible.
Township.
So have your teeth done before you come in.
Or have dental insurance.
Or have dental insurance, yeah. Or when you're spending down your money, use it for that.
Medicaid A reimbursement. Services. That was a big hit in the.
Can I ask a question?
Yeah.
I have those two lines explained in layman's terms, like why do we pay Medicare A and B for reimbursable services? What's the rationale or what's the?
So Medicare A is when a resident, maybe a patient goes to the hospital, falls, breaks a hip, they need services. You can use your Medicare A benefit for 100 days and it pays 100% coverage. And we get reimbursed at a higher rate. When somebody's getting skilled services, they call it. When it's somebody that is just getting regular therapy services, it's Med B. So when your Med A goes up, your Med B usually is down, and when your Med B goes up, your Med A goes down. It depends on what type of insurance the person is using.
Well, I'm sorry.
Does
Okay.
that,
Yes, okay. I have Medicare.
Yep.
Okay, and I have A, and I have B, and I have D, and I have all the other stuff, right?
yes.
Okay,
Alphabet.
so I've, the providers file and they get paid. Why is the county paying? Why doesn't Medicare A and B pay directly to the providers?
We get reimbursed in the revenue.
Okay,
So we have to
So
pay it
we-
first.
so this is a wash. So
And
these are
then-
a wash.
Yes.
Fine, thank you.
Don't take an advantage. Well,
I'll see you sometime
And the last line,
when I get there.
pandemic testing.
So, yeah, that's,
so we were getting, we have a company that we do at $65 per person a test. I put in for 100 tests just for a one-time thing if we have an outbreak, because we were being covered by the state, but that was only going till December. Now they just changed it and they're going till March. I don't know if they're gonna extend it again, but we do need to have money in there in case we have to pay for it. To have PCR testing.
Right.
So,
Thank you, Mr. Chair. So you said PCR testing.
Yes, POC or PCR.
Okay, so a couple of questions. One, I heard that PCR testing was supposed to end at the end of December.
Correct. And then it went to March.
Okay. Two is they have the antigen tests that every household can get up to 4 per month. Can you utilize?
We get the POC, which is the antigen test, which is called a rapid.
Right.
We get those free. We get them shipped to us. But sometimes you have to use a PCR test if you're in outbreak, which has to be done in a lab.
from what I understand, the PCR, if you had COVID in the last 2 or 3 months, you're gonna test positive under that test. But yet the other one, if you're free of COVID, the rapid test will give you a negative.
It depends on the susceptibility. So it can tell when you have the POC, it's during the time frame that you're infectious, and that will show up on the antigen testing. When you have the PCR, it can pick up live or dead virus. So that's why it can last so long, that you could be 90 days and still test positive.
Okay,
So.
I just want to hear it from another party. 'Cause
All right, so.
Very confusing.
Right. So the thing is that the PCR test, which they were gonna do away with at the end of 2021,
Yes.
because it really wasn't reliable. Because it picks up,
They call it the gold standard because you're really supposed to have a PCR to pick up COVID.
follow up, Mr. Chair, because I really want to
It's
understand.
how the test determines the viral load. And you can be cured, free of COVID, but still have that viral load in you,
But
Or
not
the antibodies
infectious,
that you-
but not infectious.
Right.
but not infectious. So it's just,
So why would you use a test that where you're not infectious? Because what it's saying is, if you're not infectious and you can't infect other people, why do you need to know? I'm asking a question.
We don't ask the questions anymore. The state is telling us, here's your rules. don't screw them up.
Right.
And that's all there is
And I
to it.
have to follow, when we have.
It doesn't have to make sense.
When we have an outbreak of so many people, and it depends if it's a resident or a staff member, who it is, where it is, when, how many happened, then we have like an algorithm that we have to follow and decide which way to go. Right now, we've been lucky enough because we're only picking up 1 or 2 people at a time. So we've been doing POC testing, which we get free, and we've been managing with that. But if it turns, we have had that happen where we've had residents that tested positive and we needed to do PCR testing, and then we have to send them out to the state lab.
And they cost $65 a piece.
The state lab is free right now until March, but if that goes away, then we will have to send them to our lab, Fulton.
One more question.
One
I'm
more.
sorry,
They
Mr.
keep
Chair.
extending the deadline, so we don't know when it's gonna end.
So if the state ends the PCR testing
Waving off.
in March,
Well, and just to be clear, they're not ending the PCR testing, they're only gonna stop
Ending
paying
the
us.
paying, the
They're not
reimbursing
gonna pay
for it.
for it.
Yeah.
Right.
They're not gonna stop doing it or forcing it, they're just gonna stop paying for it.
I heard
Article
this-
28A,
Yeah.
unfunded mandate.
Yes.
Members of Silver, I think you do have a question.
Just a comment is, you're saying you get the instant test, the home tests
Bionex now.
for free, the Abbott tests for free. All 18 members, it's my understanding, all 18 members of the delegation received a box of Abbott from the speaker's office. I'll be happy to give you my box in addition. And maybe we should ask the other reps to do the same.
I already sent mine to my daughter out.
Oh, okay.
Well, those are the ones you're getting for free.
Those
The
are at home,
rapid
but we have, I don't know if it's a higher grade one, because we have a control we have to do when we open the box. When you have an at-home one, I don't think you have a control in it. You just have 2 tests, right?
Yes.
Yeah, so I don't know if I could use them. But thank you.
All right, let's move on. Enough of this.
Could you just send employees up to represent themselves?
I can send them to you.
You can't make this stuff up. This is just ridiculous.
Right here, CDC announces dropping PCR testing for COVID-19.
Oh, well, maybe they,
Do
it's an adventure every day.
do we want to just leave that number there and hope we don't need it?
Yeah.
It's a minor. There's everything else that's going on here. That would conclude pharmacists and pharmacy. No changes. Moving on to nursing home activities.
We have 5 full-time employees.
Wow.
Finally.
So my question right now is, I have a line on full-time recommended by the commission, $206,615. Is that number real, or is that before the wage increase?
That was the number before the wage increase.
All right, I'm looking at up on your board there. and It matches what my page says, but so move over 2 lines and we're looking at 229.70
Right, that's what
under the
those,
wage.
that's what those 5 will cost with the current wage rates.
We probably should have gotten a printout of this.
You really did get a printout, and I've emailed it to you twice after I gave you the printout, and I got not a response, not a one.
We get a lot of emails.
I'm sure you do, me too.
But I haven't seen anything like this.
Well, you got this exact printout on January, twice in January, you've had it, plus you had it printed out at your meeting. Your last Well, that may not be true that it was there, but I know that's when it was mentioned that I was
I've
going to
never-
give it to
I've
you.
never seen this.
I believe you've never seen it. I'm just telling you that I've emailed it to the entire delegation twice and asked if you wanted more information on this wages. Did you want printouts for tonight? Did you want any updates? Who would you like to be present? And I
If
didn't
had
get
done
any
that, I would
response.
definitely ask for a printout tonight.
I thought someone might have been interested.
I don't know.
I saw something
And I
and I was
checked my-
trying to do it, but I wasn't.
I check my spam regularly too, and it's,
I didn't
haven't
go to your
seen it,
spam?
So I don't know what happened. I mean, I did get your,
Yeah, I did
your
email it
request
to
for the
you.
transfer, that came through. I don't know. They have a very poor internet service too, so. I mean,
Yeah, and they're probably big.
I
clients.
can't even do a Zoom without losing half of it, so. But getting back to the question of full-time wages for activities, do I hear any motions? Wages overtime,
Mr. Chairman.
Representative Silver.
Would it be a reasonable request that we be provided with this renegotiated contract that provided for all of these salary increases? Get a copy of it?
The only
Well-
document that was negotiated with them was the wage scales, which I did send you. You did get all that in your email, but I'm happy to email it again.
I got it. I just
I know,
understand it.
yes.
There's a lot of numbers and a lot of things in it, but I didn't know what it was before. I mean, giving me a new wage scale, but not knowing what it was prior.
If you have an exhibit, basically a wage scale, which is an exhibit, it normally contemplates as an exhibit to some other document that says, we are increasing the compensation pursuant to this wage, this new schedule. Where is that document?
I'll look and see what if, I may just not be remembering, but let me look at the contract because we did go back and forth with him. I don't know, I do know they re-signed something, so I'm sure there's something.
So,
Maybe we can have it for the next week's full delegation meeting.
I'll
maybe
email it to you.
A
I'll
printout
email
of
it
this
first thing in the
for every
morning.
member, in case they didn't get it, whatever, missed it. And, hard copy of what Representative Silver's asked for. Representative Comtroff.
thank you, Mr. Chair. So I guess my question is we put out money for a salary study, wage study, whatever you want, right? We're spending all this money out of ARPA funds for this. And yet we didn't wait for that study to come back. And we increased wages on a union contract where those union contractors are, some of them, I don't know if they're up this year or next year.
Yes.
But they've increased the burden to the taxpayers without anyone actually, unless you attend the commissioners' meetings, I would assume, that nobody was aware of. And I don't have, and we were granting additional dollars from the ARPA funds to increase people's pay to help offset what they were making, not to go back and renegotiate a union contract.
Well, those are two different animals.
Hmm.
And
Right, but the thing
and
was, is the
the
reason we were,
contract, the delegation appropriates funding for that contract. We never appropriated the funding for that contract.
right, well,
For the
they're trying,
revision, yeah.
right, we're trying to appropriate it through the budget that we never got to look at, the union contract. But what I'm trying to say is the reason we were giving people extra dollars, in the nursing home, an additional $5 an hour on top of what they were making through the ARPA funds was to help supplement their wages, okay? And then the other, everybody else in the county was getting $2,500 for a bonus. And I don't know if there's a wage, it was a wage issue with the rest of the county. And so the question becomes is, you know, people can call it free money, whatever they want. It's taxpayer money, no matter how you slice it. And I thought the reason that we had the opera funds was to help maintain that until we got our wage study back. So then we could look at everything. And then when the union contracts came up, we would renegotiate. I mean, that was my understanding.
My understanding of
Maybe I'm wrong.
ARPA was, it's the American Rescue Plan, not the County Employees Rescue Plan or the Public Sector Rescue Plan. It was supposed to be monies for everybody, and you know, you can't give it to just anybody. You can only give it to public employees or nonprofits. Or go ahead.
So, Mr. Chairman, let me just see if I, in my simplified way,
Okay.
since I was not a math major, we appropriated ARPA funds for the nursing home staff to try to bring them up, to incentivize them to stay, right? And we have authorized somewhere along the line, a wage study, a compensation study has been authorized, but a report has not been received. Notwithstanding that, the contract with a bunch of employees has been renegotiated upward for compensation without a report on the compensation study and without the approval of the delegation of the revision to the contract. Is that the accurate?
That's my
What happened?
understanding of it. Yeah.
Okay, thank you.
Wages overtime.
Activities. Wages over.
Really down to entertainment and general operating supplies. Those are the like items that sort of went crazy here.
And so, no. Activity awards. The next line item with a number in it. See any hands? Representative Humphrey?
Just a quick question. On the longevity awards, how long? Okay, you have 1280. So 2 of these people have been here for a while.
But the longevity awards are different with each contract group, right?
They may be, I think at this point, they may be all the same at this point. Not exactly sure of all 4 are, but I think after 5 years, you get $280. 10 years, you get 380. Probably 15 and then 20.
We got 450, 550, and 280.
That's how we keep Shelley here. So $380.
That's why you guys got me.
I'm sure it is.
I'm trying to make 20.
You only get
20 years.
4 more years to go.
I know, so, but it feels like a lot now.
Because
What are you
you
trying
can
to
see the
say?
end.
What are you trying to say, Shelley?
It's because she can see the end.
Well, yeah, but I won't be old enough to collect Social Security or Medicare. And I'll need health insurance, so you guys will be stuck with me for a little longer.
Okay.
As long as you can put up with this.
Moving along.
So is activities done? Hairdressing?
Did we do any adjustments in,
No,
no adjustments in activities?
no, unless you
Not
want to.
yet. So the next line is health insurance, it's pretty much a fixed number. Payroll tax. Retirement. So looking at that sheet up on the board, these numbers we're approving tonight are before the so-called renegotiation.
The way I look at Mr. Chair is these are the numbers that we were given to approve.
Exactly, so these
So
numbers
that's what I have to go
we're
by.
working on out of the requested budget.
That's right.
Employment, workers' compensation, entertainment. There's quite a bit of increase in entertainment. We are entertaining the activities directors now?
No, entertainment, I put in what I usually put in for a budget every year. Entertainment is the 44, and then general operating supplies is 5,000. Looking at, a full census, we're doing everything that we normally do. However, we all know because of COVID, we have certain restrictions. So if you'd like to negotiate, I'm thinking maybe 3,000.
2,500,
2,500
How much?
entertainment.
2,500.
I
Is that a motion?
I think 3,000 because I have a singing group that is vaccinated. It's worth a try, right?
I'll make a motion for entertainment at 2,500.
Second,
Okay, but you need to
Is
leave
that
general
barbershop
operating supplies
quartet
good.
or
Because
acapella?
we do crafts and hallway bingo and we do the prices right. So you need to leave that where
I'm
it
not
is.
touching that one.
Okay, good.
I can't vote for anyone else.
What was the motion?
$2,500 on entertainment.
2,500?
Yeah,
Second, that's so.
And if I need more, I can always come back, correct?
Not before you spend it and not after you spend it,
Correct.
but yes,
And
any
I'm
other
pretty
time.
sure you're gonna-
Any other comments? All those in favor?
Aye.
General operating supplies,
Good number.
general operating supplies. Historically, it looks like it's been 4,500. Don't understand why even with the reduction in participants, how much bingo chips cost.
Well, it's not the chips, it's the prizes.
everyone loves bingo.
Yeah, you can take away hallway bingo.
Well, I-
Take away their oxygen, just don't mess with it. bingo.
That's right, that's right. The hairdresser and bingo, top priorities.
It's true. That was my great aunt. Don't take away her bingo and don't take away the hairdresser, even though she didn't have any hair, but
Hey, I gotta give them credit. I mean, at their age, they can sit there and play 30 cards. I had trouble with 2. So,
No, 30 cards in the coveralls.
all right, so that wraps activities with a slight reduction. So what's the new bottom line on activities?
358, 160,
358?
160.
Hairdressing. We're not gonna mess with that one either.
Looks good.
Let's go all the way through. So. That concludes. Nothing. Have a new bottom line on the nursing home?
I don't do that yet.
No, okay, no.
I have it, if you want it. But $12,076,103.
I've got two weeks spreadsheets, so I have to combine.
We're gonna go home or are we gonna continue?
I can tell you what I vote for.
Well, don't we have tomorrow night?
Yes.
I'm good.
We'd be looking at the revenue.
I was gonna ask you about the revenue.
Yeah, did you get it done tonight?
We can look at revenue, yeah.
Yeah, right, so.
This is a crystal ball.
All right, so these revenues are based off of when it's full capacity, so you'd have to take, this is 2/3 of $12 million. You know, minus the fact that
We-
Of
expenditures.
what you did with the expenditure.
We still need to go back through and adjust some numbers
Yeah, and
and do a final bottom line.
an issue to raise and
We
Going
can,
back. maybe that's tomorrow night.
well, yeah, we can do that. We'll do revenues tonight, and we can,
I'll look back tomorrow.
so, under revenues. On the attorney, were there any, there was any,
I have that you did
Warrant.
that.
Yeah, we did do that
We
one.
already
Yeah, you
did
did
that.
that, you did county administration. I'm not sure about finance. Do you know, Barbara, if that was?
I have, let's see.
Finance would include the fund balance.
Yeah.
Which we haven't decided on.
All right, you did register deeds. I was kind of delirious at home, so I also don't know if you did the sheriff's department.
And corrections, I showed, we did
You
corrections as
did,
well.
okay, and yep, you definitely did corrections. And restorative justice. I don't know about health and human services.
I did, I'm just trying to get to where I.
restorative justice?
Yes, you definitely did restorative justice
Sheriff's Department.
and
Okay,
sheriff and
revenue.
corrections. You'll have to get me the sheriff's numbers.
I mean, I'm not seeing any modification
Well,
that
Yeah.
we made.
Mr. Chairman,
We did.
I would just like to point out that in the corrections department, there's 0 shown for grants.
Right, we talked about
And we
that.
talked about it, and no grant applications are pending,
Right.
notwithstanding the fact that there are grants for all the prior years shown.
Right, so the Department of Education is no longer offering the grants that had been applied for year after year in the past.
So I have revenue for corrections and revenue for deeds. That's what we did.
So you don't have the sheriff's numbers either. I don't have them.
I just have corrections and deeds.
Yeah, all right.
I show the sheriff's numbers
I believe
unchanged.
those were discussed when we met the sheriff.
Right.
I believe the only
We
one-
went through
discussed
that.
them, but we didn't do anything with them, I
I
don't
believe
think.
the only revenues that haven't been discussed yet are the nursing home revenues.
Right. Yeah. We may have discussed it, but we didn't actually go over anything.
Well, just looking at the court security and the sheriff's department, if you, I'm not sure what. You reduce the expenditures, so if you leave the full revenue in there, that's gonna be problematic.
Was there discussion of more money coming from the court system to assist them? That's questionable at this point.
We did talk about that, yeah.
Yeah, that was in pending legislation, though, isn't it?
Right.
Yeah, so,
Yeah, I would note that that number is assuming no change in legislation.
I have that.
Also, it'd be even more if the legislation passes.
Well, no, so last year, I think that we set at what, 200,000, I think was the budget.
252, 750, oh,
No,
the
that's
expense,
what we requested this year. The
Right.
252, so that shows the increase of staffing that we were looking at for the courthouse. But we didn't take into account whether that legislation was gonna pass or not.
so that the revenues for the court security are based on the numbers that exist today and not what future legislation.
It's based, so the revenue was based on the number of personnel that I had anticipated on employing for that duration.
Okay,
So that would be 9 people for 150 days.
but it's based on the actual standing
Correct.
figures.
Yep, the
Right
current
here and
figure
now,
right now.
right, okay. So if legislation does pass and there's an increase in revenues to the county, that would just be in, you know,
An increase in that revenue source.
increase in
yes.
that line item when it comes in.
You could figure about $55 a person, so that's 3 people a day. Or we'll just hypothetically say 200 days.
I'm not gonna count my chickens till the eggs hatch, so.
So it passes the House, I don't count it at all. Passing the House is the least of your worries.
It's true.
Okay, so let's look at the
It's not going order, county attorney, right?
you did do
It was covered.
85,000.
Right.
we
didn't
didn't
change
make
it.
any
Right.
adjustments to any of these numbers because there's so much
Unknowns?
unknown, yeah. I mean, if we do nursing homes.
Yeah.
So we're starting with pro-share. Talk about unknowns.
It's our best guess.
At 1.9. And is that for, is that based on consensus?
We heard that number in a meeting.
It just looks like the trend. It's, I don't know if there's gonna be a change to it or not. It almost feels like they tell us what it's gonna be and that we should be thankful.
No, that pro-share is calculated based on the number of beds we have, right?
What it's calculated on.
Only the counties get it. The difference between Medicare and
Supposed to make up for
Medicare.
the
Make up the
difference
difference.
of the loss that we take for
Because
having to
we're
take
higher
Medicaid
Medicaid.
residents. That's the intention of it.
Right.
But how they calculate it, I don't know.
Government at its best.
And there's a lot of question about this FMAP And whether they're applying that or not, it's supposed to go back to the counties, and the state has a unique way of calculating it that none of us are able to figure out.
So for this past year, 21, we had budgeted an anticipation of 2,100,000. We actually received 1,960,435. Is that the final number
Yes,
of this year?
it's one payment. We get one payment in June, the end of June.
So it looks like they stopped that, everything being equal, we're anticipating 1,900,000 for this year.
Yeah, I don't know how it would be.
I don't know if
Picking a higher number is, I think, dangerous because it's more likely that it's going down than up.
that seems to be the trend.
Yes, it is.
So I guess we well enough alone on that one. Resident resources.
These are all calculated at 100% census.
Okay.
And
So, and we know.
so we
at
know we're not
two-thirds.
gonna be 100% occupancy already. So do we really want to anticipate that much revenue when we know we're not gonna get it?
No,
No,
not now that
no.
you cut the expense. You know, I think the theory was if you're gonna budget for 2/3 capacity on the expense side, that you would do the same thing on the revenue side.
So I'll make a motion for 950.
950? It'd be 950,000.
That would be 950,000.
All right, so what's the number?
Resident resources,
I have a second.
How much is it?
950,000. We are reducing the revenue.
Expected revenue because of the census being down.
Right.
Second,
Any discussion, or comments? All in favor?
aye.
All right, so 3-1. Show me the- Next line, Medicaid.
You're gonna have to decrease those numbers.
With that
Right, 'cause aren't
number,
we
that
going up?
number is actually per resident.
So Mike, but we didn't touch the other Medicaid numbers of the Part A and Part B.
This is for actual resident taxes.
This is for, 94.
So Medicaid is actually for just the residents, not special, not needing special needs. not
It's just room
on
and
the
board.
Med A or Med
It's
B,
just
that's
room and board street.
That's just the rent.
That's right.
Yeah,
Room
yeah,
and board,
Correct. Correct.
So. Want to adjust that number?
We're never gonna get it.
Yeah, you'll need.
yeah.
Not hearing the motion.
2736,
27, 26.
because we have 68 beds right now, right?
Did you say 2.6 or 3.6?
60.
60,
60.
and we have 90.
94.
94.
Now, do they get a cost of living increase on this?
Medicaid rate,
It's,
Yeah,
yeah,
but
our new
the
rate's 206.
Federal rate is.
did it go up from last year?
Yeah. $4, 389. For Social Security, $74.
And Social Security go up 6%. Even cost of living increase, yeah.
$74.
Yeah.
$74.
Mine almost increased my tax. My tax,
Well, $74 is what
They have to pay, right.
all right. So I'm waiting for a motion to,
A number.
I did a motion, 2736.
oh, okay, I thought you were still.
No.
2736.
27.
2,736,000.
Second.
Seconded by Representative Silver. All those in favor? Aye. Opposed? No. One opposed.
Census down to all.
All right.
Yeah.
I think Medicaid,
I'm not touching that. A and B, we didn't touch.
So A and B.
you didn't touch anything on the other side, so we'll just skip right over that one. Private pay. Is this in anticipation of bringing in more private pay?
I
or-
think you should decrease it.
Like in half.
Yeah,
Yeah, we're not gonna bring in any more of anybody.
right. We have 5 private pays right now. We normally run about 14.
And we only had 7 this year.
Oh, yeah.
So. May I, Mr. Chair?
Go ahead.
So just a quick question, if you had the opportunity to bring in a private pay, would you?
Right now.
We don't have anyone to take care of.
We don't have the staff to take care of
Back
it.
to
I understand that, I was just asking the question.
Yeah.
There was a reason for it.
No, I wouldn't.
We have a list of people waiting, so as soon as we can, we
I have
will.
like 75
Not to mention the
people.
pressure from the hospital saying,
Right, actually, a Med A person would be more than a private pay person. But that's not our mission. Our mission is to take care of the needy in the community.
Right.
Not hearing any,
It's freaking hard.
not hearing any motion, we'll move on to the next one. Medicaid incentives.
What is that?
That is the extra money left over from the state that we get. What do we get quarterly? Installments?
And then we'll get 1 extra or 2 extra.
What do they base that on?
it's the money they
It's-
didn't end up spending on other nursing.
In all the
homes.
other nursing homes in the state. And it's split between what, 79 nursing homes? The county
What's
gets
left
pro
over.
share. Yeah. And Medicaid incentive is left over and given to all the nursing homes. Split.
Based on.
That's based on the algorithm that they do of the money that they get for Medicaid for the state.
It's like the Twitter algorithms.
No,
It's a calculation that they send us. And if there's extra money, we get an extra payment.
it's one of those hard saying unknown, right?
That's
Yeah.
exactly right.
So,
It is
We'll
hard
get
to
that
figure
one.
out. I mean, we've been
Mm.
trying to figure it out.
It's hard for them to explain it to us.
Yeah.
co-insurance,
I mean, this is all part of stuff that I think.
Excuse me.
A.
Yeah, we're never,
Never,
Did any-
no, we haven't received $2 million in Medicaid
ever,
incentive ever.
well, since I've
Well, that's what you guys put down for the
Based
budget.
on 100% census.
Right.
And even then, we never had it.
Didn't I hear a comment by somebody that says 700,000?
No, that was on
Oh.
Medicaid.
Right.
That was
That's on private pay.
That was private.
Private
pay.
pay.
So
Okay.
right now, you're setting us up really for a problem here.
These revenues that are directly tied to census all need to be adjusted based off of the executive committee's decision to reduce the expenditures based off of 60% or 60.
The less census.
Smaller.
Two-thirds census.
Yeah, two-thirds census, right? So the expenditures were budgeted at full capacity and the revenues were budgeted at full capacity. Generated a $1.3 million tax base to the residents.
So
Get the two together.
if I look at private pay at 2/3, that would be $925,000. At 2/3.
Yeah, that's total.
Yeah, that would be wishful.
That's optimistic.
That's very
For private pay?
Yeah.
Unless we go up with the rates.
I'm just looking at the historical.
Or if we can staff the place, right? If we can get staff, then we can.
Although we just cut the wages, so we won't be hiring more staff.
I'm sorry, I missed what you said.
I didn't say anything.
Oh.
I was just looking at the historical numbers. Because we were at 1 million,
Nothing
1.4
fits anymore.
million, 1.3
No historical numbers, nothing.
million. And then in 2021 was 710. What is your consensus now compared to 2021? More or less?
Private pay, less private.
The census. We
Yeah.
Oh,
have
the
60
census.
residents. How many do we have on average in 2021?
Tell you what we had each month.
Scroll down, get it.
You gotta calculate it.
Well, just go
I
ahead.
can tell you how many people we had
Fine.
each month.
That's fine. Go ahead.
Okay, January 68, February 66, March 67, April 68, May 68, June 68, July 66, August 66, September 66, October 65, November 64, December 62.
Yeah, but those went all private. Yeah.
No,
No,
but
that's
you
just the
just want the
census.
consensus,
That's
right?
the census.
So that's an average of 66 people.
Okay.
Which is what, and you said we have 94 beds, right?
Yep.
So it's 70% capacity.
Last year's average was 70%.
I had 66, yeah.
And we're at 60 right
So if we can hire a bunch of people, we can maybe get back up to that.
I'm still not hearing any more from the stuff.
Heard it almost.
I'll reduce private pay to 925. I'll make a motion.
What is that? Second.
I'll second it. For discussion. We're flying awfully blind here.
Discussion is hard saying, not knowing, so.
Well, yeah, we're flying blind. We don't know what, there's no parameters.
So. Just move the question. All those in favor?
Aye.
Opposed? No. One. Medicaid incentive, that's one surplus funds in the state that go flying around. We have $200 million in state surplus. I'm gonna hope that some of that comes to the nursing homes.
Wasn't there something in legislation to put more money back to the counties?
Yeah, there is. I haven't seen that yet. The towns and the counties were supposed to get some revenues.
Yeah.
I know the county doesn't get any of the revenues from the meals tax. But were there any revenues that came in from the state on, how was that appropriated? That was appropriated through. It was $100 million that they appropriated.
Are you talking about the room and meals?
It was an article in House Bill 2. Remember, we were supposed to go out there and promote it, that we gave $100 million back to the communities.
And there's a list, they issued a list of all the
Did the
communities. that
counties
got
get
money.
any of that?
I don't think so, just.
No, we don't get any.
I don't know
Towns and
of any.
cities.
It's just the towns.
Towns and cities.
So. All right. Anything else?
Motion to adjourn.
Well. So, yeah.
Question on the miscellaneous, we had a big bonus of $682,000 one year. What was that all about?
That was the CARES Act money. That we were, the CARES Act money, yeah. That, we did get a little more in 2021, that 124,000. But I don't have any reason to think we're getting any. I think that's,
No.
in fact, we don't even want it. It's one of those deals that they sent us the money and then we had to justify keeping it. Which is not easy.
And then we get 156,000 from pandemic testing.
We're definitely not getting any of that.
Yeah, meal sales, which is, I'm assuming the sale of meals to the county correction, right?
No,
Or to others?
it was staff and visitors.
Okay, you don't have any dollars in there.
We're not charging them.
We haven't been charging meals.
So staff eats free. Yep.
Don't worry, it's in the contract.
And it's really only impacting the nursing home employees because the rest of us can't go over there. So
Wow.
Right. It's only
Right.
our staff.
Okay.
So all the guys in the jail, even though the inmates are getting meals, they're not getting meals?
they bring their own. When they go out to eat.
All right, so we have a new total on nursing home.
I have 10,163,000. Yeah, for the nursing home administration.
Total nursing home, 10 million.
163. Yeah, that might.
Okay. I think we are done with Shelley.
Oh, I just had a question, because I didn't hear. The Medicaid incentive, is that still 2 million?
So, I mean, the state has more money than they know what to do with now anyway, so.
They know not to give it to us.
I was gonna
Guarantee
say.
that.
So,
Well, maybe we can twist some thumbs over there. questions or concerns? That's all.
I'm just missing $1 million on the bottom line. I have an extra million.
You have the nursing home number?
The nursing home number is right, the general fund, I've got 70.
Whoops. $17,323, is that what that?
Got 393,
Oh, 390, that's 70.
107. Start at the top and work down.
Yeah.
85.
Yeah.
4, 856, 782.
That's a problem.
Administration, what did I do?
Well, I have 250,000 for gun stock.
Yep.
Transfer from ARPA, 4,101,566.
Yep.
100,000 unanticipated.
Yep.
285,216.
Yep.
100,000.
180. That was something I was going to throw out that we didn't. We discussed this previously.
I don't know if we did.
I think that might have been something I was.
I don't think we discussed county administration revenues.
Right, tomorrow night, see, it must be in your minutes somewhere. Yeah.
Yep, I'll look at that.
Oh, I don't have those minutes.
So was it done on the 27th?
No, it would have been in the first, probably in the first meeting.
The 27th.
Was that 27th?
Nothing on the 28th.
Would you like to take a motion on the county administration insurance rebate line?
Administration insurance rebate line. Okay.
Let's move $120,000.
Second.
The motion.
Yeah, I think historical supports 20 is the line that varies a little bit, but it's probably in line.
Favor?
Aye. The number on the transfer from ARPA in that line? 4 million what?
101,566.
566, thank you.
I don't have that.
401,566.
Second at the county administration of the insurance rebate.
I did.
Fix that problem.
17,343,707.
It's up to 70,000.
Oh, sorry.
What happens?
Yeah, but still 50.
Finance,
So that's 7,000. Needs is 1,398.
348.
What register of deeds?
1.3 million, $34,025,
There's another motion coming.
What?
14,000
What?
and 400
It's in deeds.
deeds revenue.
Mhm. Yeah, we didn't change anything in that.
Didn't.
You good with that?
We could.
Yep, I was expecting another $50,000 on that. So that is that changing? Change. What's your bottom line?
What do you have for general fund?
17,343,707.
Okay. Oh, no. Kirk doesn't have it to get a problem. It's their numbers are official.
Got those numbers.
You do have it?
17,343,707, yeah. I do.
Not put anything in from fund balance, so
Well, this time-
reserve that for.
Well, we still have to go
Another
back
day.
and approve all the other numbers too.
There's a couple of lines that, going back, when we go tomorrow, there's a couple of lines I'd like to discuss.
So can I make a motion to adjourn now?
Just before we do that, one thing I'd like to go back and take another look at is this mid-state transportation.
Yeah.
With
Oh, yeah, meals and.
meals and senior visit. I've watched this bus go through Concord twice now in the last week or so. Empty. I'm wondering if we're supporting a duplication of services in some way here. Because, we already have public transportation. And I don't see any difference between the public transportation buses and what these bus lines are. These buses look like. I just don't. I don't know what the end game is. I can understand occasionally someone needs a ride who is maybe a, wheelchair bound or something like that. Run a whole bus network for those specific individuals. I'm not sure if this is something we really want to, where is this going to end up?
Is it appropriate or not?
Yeah, where is this gonna end up 10 years down the road? Is this gonna be a $1 million budget for this thing?
This is the on-call thing where people call in and make a reservation and they get picked up and dropped off. Is that the way that works?
Well, that's how it used to be, but now it's like we're making particular runs, whether someone's there or not, is what it looks like. Sort of like the regular public transportation, they show up at the bus stop whether someone's there or not.
Got it. Yeah. Okay, we'll look at that tomorrow.
So we'll, I don't know. Give another look at this thing.
Sounds like it's deserving of another look.
You have any specific departments that you're looking at tomorrow, just so I could let those department heads know?
I've got some issues with the sheriff's department.
Okay.
Nursing homes all set.
The meeting
You're free to go,
continues
Joe.
tomorrow.
We're gonna be skimming through the entire budget.
Tomorrow?
Just a quick overview. There was a couple of things we need to adjust. Is it sick incentive?
Oh, you did that tonight.
for,
Oh, not for.
Yeah, we need
It's
to do it
only
for every
everything.
Couple
department.
of departments, we still have to adjust on that. You know, nothing major.
Not my longevity.
Zero.
Yeah, all right, I'll take that motion.
Motion to adjourn.
Okay. At 8